Hi and welcome to ScheinChats. I'm Jason Longden, Connect Manager for Henry Schein UK. With me today, sitting alongside me, is Dr. Simon Fieldhouse, Practice Principal at Dutch Barton Dental.
Hello, Jason.
And we're here today at the BDIA Annual Showcase to discuss how you developed digital dentistry within your practice. So welcome, Simon. Thank you for taking the time out to chat with us.
Thank you.
So, Tom, could you tell us a little bit about how you got into digital dentistry and the journey that you've undertaken?
Yeah, certainly. It started actually back when I was a dental student in Liverpool, and we had one of the first CEREC 1 and CEREC 2 machines there. So from my undergraduate days, I'd always been interested in it, but I was aware that in the early days, to be honest, whilst it was very exciting, it wasn't capable of delivering what you need on the high street, if you like. So I'd followed it for many, many years, and then there came a point when it was very obvious that it was absolutely good enough for what we wanted it to do. Changes in materials was a big thing, changes in the technology. So a few years ago now, we decided we're going to go for it. We're a private general practice. We do quite a lot of implant work. So the thing that led me into it was we wanted our own CBCT scanner. But of course, alongside that, the people that came to sell me one of these said, "Are you looking at CAD/CAM?" And I said, "Well, I'm interested in it," and so that's where it started. And whereas some people are cautious and they say, "Well, I'll just dip my toe into this market," we decided that once we'd looked at it, we'd done our due diligence, if you like, we'd go for it. So we did. So we thought we're going to go for the full digital workflow. So initially, two of us in the practice started scanning, milling, learning how to make our own surgical guides from our CBCT scans, and very quickly our associates were sort of looking around the corner and saying, "That looks good, what's going on?" And we said, "Oh, well, you know," and obviously within 12 months we literally doubled the hardware that we bought. So now we've got 4 acquisition units, we've got 2 mills, we've got 2 furnaces, we've got a CBCT scanner, we have a 3D printer, and it's totally transformed what we do. Totally transformed what we do. It's fantastic.
Fantastic. And you mentioned due diligence in there.
Yeah.
What were the kind of things that when you were looking to assess, you were doing the due diligence, what were the things you were looking at? What were the criteria?
Well, with your sort of clinician's hat on, if you like, we're looking for clinical evidence as to the efficacy, how accurate are these things. And so, we did a fair amount of that, aware that there's probably 15 or more intraoral scanners out there. So looking at comparison studies. So we did the science, but also then it was about developing a relationship with suppliers. Who did we feel we could trust? Who, were we able to see beyond the sales talk, and are we going to get the backup we need? So that certainly was a factor. The reality is that when you're investing a large sum of money in these things, everybody's pretty much the same when it comes to the financial side. So it's all about relationships, I would say. So that was a factor.
Was a big factor in there?
Yes.
And the follow-up service?
Absolutely, yeah. It's, for people that are thinking of going into digital dentistry, I'll quote from Shia LaBeouf and say, "Just do it," or something like that. And but the thing is, you've got to make sure that once you've invested, you get the right training, the right backup, the right post-sales support, and that's not the same. I've been very lucky. The suppliers I've had have been very good. They're either on the end of the phone or an email, or they'll come and see me, and you develop a rapport with them. And some are better than others. And as I say, where I am now, the people I deal with are very good.
And you mentioned training there quite a few times.
Yep.
How important is training in getting into the digital journey, the digital workflow?
It's essential. There are a lot of misconceptions about digital dentistry and the fact that it's an extremely difficult thing to do. It's a steep learning curve, and whilst that is true, it's particularly with the newer softwares and the newer scanners, it's very, very intuitive. So there's plenty of training available, and it varies from one individual to another as to how much they need. So, what you need is available, less, more. I've certainly not had a problem with getting input, getting train up, getting a few tweaks if necessary. That's always been really straightforward. And the suppliers now and manufacturers, they're developing linear training pathways, which I think is really important. Yes, it's CPD, but this hardware and software is really powerful, and you can do a lot with it. But if you're going to do a lot with it, you need to do it properly. I say to associates that work for me, look, this equipment is amazing, but it's a double-edged sword. So patients are aware that we've got some clever stuff here, and we can do a lot more with it. And because we can do a lot more, we often have to do a lot more. And there's a bit of chicken and egg there, but obviously if we have to do a lot more, we also have to do it properly, and that's where the training comes in.
Absolutely critical. Fantastic. And you mentioned your associates there. So
yes.
Could you tell us a little bit about team engagement maybe, and how that was adopted?
To start with, just myself and the sort of people that were investing in it, if you like, we started using it, but as I said before, our associates very quickly became very interested, and when they came on board with doing the sort of full digital workflow, as I say, we doubled our investment almost overnight. And recently...
Doubled your investment?
Doubled our investment. Well, within 12 months. We made our first investment, and then we literally doubled up in terms of scanners, in terms of mills, another furnace. That was when we bought the 3D printer, because within 12 months it was really obvious that for us it made our patients' lives much better, it made our staff's life much better, and it made my life better as well. My working day is far more relaxed, it's more flexible, the staff are more relaxed, probably because I'm more relaxed, but they really love it. And in terms of getting the team involved, obviously with the appropriate training, our nurses do a lot of the tints and glazes on the crowns and bridges that we manufacture, and the girls, the boys, whoever's doing it, they really enjoy it. They get a lot more out of their job. They get a lot more job satisfaction, and they're really involved in the whole process now. I will always have two pairs of eyes looking at shades, and the reality is they're probably better at it than I am. I, of course, taught them everything they know in terms of making crowns, but they're excellent. They're very good. We pay them a little bit more now, which they like as well, but their job satisfaction's going through the roof.
And have you found an improved staff retention?
Yeah. I mean, the buy-in's been brilliant. The staff really, really do enjoy it. I mean, not just the fact that they physically get involved in making the prosthetics. It's easier for them in surgery. The nurses, there's no mess if you're doing a crown prep. There are no impression materials around. That's fantastic. And you say to them, should we do something the old way? And they just go, are you mad? And I say, well, I was only joking, girls, But there's no way we take a backward step. And we're just doing more and more digitally. And it's a question of what next, really. I mean, we do all our implants digitally. We do our implant planning digitally.
Okay.
And also, as a practice owner, people talk about numbers. There's a conception which is correct that you do have to invest quite heavily in this, but as you know, you'd be surprised how little you actually have to do in terms of work to make it pay. Some people don't like to talk about numbers and finance, but in the real world we have to. And one of the biggest benefits for us actually is it's made us a lot more profitable. A lot more profitable because we're busy, but people will be surprised how few crowns or bridge work or implant crowns they have to do because of actually the savings you make. If you're making your own surgical guides, that can cost me anything between £3 and £45 if I print it or mill it. People know that surgical guides, if you order them, at between £200 and £400. So and again, blocks for crowns, £15 each. Lab fees for some of the top-end crowns are an awful lot more than £15. So, the numbers really stack up.
Start to stack up on that.
And that's the thing that most business owners talk to me about. And I say, that's great, but it's not all about you. The patients are blown away by the technology because, I'm going on and on.
But
we're producing high-quality work. They're not having to have impressions. It's one visit. Most people know this now, but the reality is it's made a massive difference to them as well. And they do tell their friends. Obviously they don't get out much, but, they tell their friends all about the technology. And we find also practitioners that don't have the technology, do refer patients to us that can't tolerate impressions. Because we're a referral practice, they know they'll get their patient back, but we don't get many, but that was something I didn't expect. This patient needs a crown, they can't tolerate impressions, could you do it please? Very happy to. And that's just another thing that is a benefit.
And how have you found the patient, educating patients through using digital, digital scanning?
They are, because they're interested in the technology, and I don't know which comes first, I guess it's their interest in the technology, it has made them a lot more aware of what's going on in their mouths. I mean, certainly the patient journey, if you like now, will often involve one of the nurses doing an intraoral scan. So if I want study models now, which for some cases, many cases I do, that's all done digitally. And of course, if you're then projecting that onto a big screen in the surgery, and they might be looking at their CVCT, they might be looking at the implant planning, they're really so much more engaged. And that again is quite powerful. And they're just, as I said, they're just more aware of what's going on, which I suppose the lawyers would say that's a good thing from a consent point of view, but if they're more engaged, they're buying more into your practice.
Yeah.
It's a more positive experience for them.
Into that. And if you could give three pieces of advice to a colleague or somebody within the dental industry in terms of getting going with digital dentistry, what would that be?
The first thing is talk to somebody that does it all the time. Because they have no vested interest in anything in particular other than telling you the truth, I would hope. Certainly people that talk to me, I say, look, and we talk about what we've talked about. So do your homework, speak to the manufacturers, speak to the suppliers, and to quote from the great Shia LaBeouf again, I would say, just do it.
Just do it. Yeah. Okay. And in terms of patients, what would you say if you were going to promote something out to patients regarding digital dentistry, what would that be?
It's very much more time efficient. Time is precious to everybody. So one visit rather than two, no temporaries, no impressions. These are all things that matter to patients. One of the things that surprised me is some of my patients I've known for a number of years, and they've had crowns done in what some people will call the analog way, the old way, with impression materials. Then they have it done digitally, and they'll say, "Oh, do you know, Simon, I used to hate those impressions." And I say, "Oh, I didn't really realise that," and I thought I knew them. And so it's all positive. And then some of them are so interested, they like to see the machines, and they go home and tell it, and they really do talk about it.
Fantastic.
Which is good.
Well, thank you, Simon. Thank you for taking the time to chat to us today, and to our viewers, and for tuning in, and we'll see you next time on ScheinChats.